3, 2, and 1, and we are, let me just get that up there. And going now. Hey everybody, my name is John Malanka with United Patients Group, and I am moderating an upcoming event with the MCRAA, excuse me, I'm gonna take that again, 3, 2, and 1. Hey everybody, this is John Malanka with United Patients Group, and I've been honored to moderate an upcoming event called the MCRAA. That's the Medical Cannabis Research Advocacy Alliance. It's a physician-led, patient-focused, multi-stakeholder coalition which seeks to educate patients, policymakers, and the medical community about the crucial need to advance medical cannabis research in order to protect patients, further scientific knowledge, and to realize the full potential of evidence-based medical cannabis treatments that can positively impact and improve patient health and well-being. And with that, I'm here with Dr. David Haas, who is not only a board member of the MCRAA, but also a co-chair for this upcoming event, which is Medical Cannabis, Advancing Research and Policy in the Modern Age. And that takes place on March 13th, 2021 from 11 a.m. to 3 p.m. Eastern Standard Time. So David, welcome.
Thanks so much, John. It's a pleasure and a privilege to be on.
Pleasure to have you on too, and thank you for being part of the board and inviting me on to be on this side of the camera as well. How does it? I mean, your background it just goes on and on, from Yale, Cornell, University of Pennsylvania, and I know I'm missing a few other of your accolades in there. How does someone with that type of a background turn to cannabis? Because it's still, the stigma is still there. And I know this is what this whole organization is about, is bringing education to the policymakers as well as other medical experts such as yourself. So please share.
Sure, thanks. So, you know, it's interesting. Obviously, I'm a clinical gastroenterologist trained at a U.S. medical school, so allopathically trained. And one of the things that's always been interesting to me is that I think that patients really are the best sources of information. And a lot of times physicians don't always see the benefit in being able to learn from their patients. And about 10 years ago, and this is well after I'd finished my training, I became very interested in, as a gastroenterologist, dealing with a lot of patients who have both functional bowel disease. And for your listeners, functional bowel disease is typically conditions where people have real pain or they have real discomfort, either due to hyperactive nerves or increased sensitivity to normal stimuli that others may not have a sensitivity to, but they have real discomfort. And we just can't point to an image on an endoscopy or an image on an x-ray or a lab result and say, this is why you're having the pain. But they certainly turn for those kinds of conditions when traditional allopathic prescribed medicines have not done the job, to self-empowering with other types of modalities. And I don't think that a lot of physicians, I'm not going to say all, because I have a number of colleagues who really are open-minded about it, but a lot of physicians, just by the fact that they're not necessarily as well versed in some of those complementary and alternative therapies, they're not always as embracing or willing to ask or inquire about those kinds of things with their patients. And so patients frequently will feel nervous or reluctant to share because they don't want their physician to be looking down upon them or intruding upon that patient-doctor relationship or thinking less of them. I decided about a decade or so more ago that that was the wrong way to go, and tried to, through some background that I had interest in pharmacology and had done a number of research with looking at the supplement industry and how it was regulated, that this was really a knowledge base that is so important for any physician to at least be open-minded about, because it can only help you develop a better rapport with your patient. So I started looking at modalities that were touted to help with functional abdominal pain that weren't necessarily traditional modalities. And I looked at things like acupuncture and Chinese herbal medicine and Reiki therapy, and hypnotherapy and cognitive behavioral therapy seemed to be the two that were the most evidence and research driven. And as a scientist, I really rely and am very research driven. So I wanted to make sure that I had background and backing, so to speak, from a research perspective for these modalities. And I became a certified hypnotherapist and started implementing that into my armamentarium to help with patients who had been through every scan, every test, every lab result, every medication that's traditionally prescribed and still not feeling well. And it was amazing to see the impact that it would have on patients who had frequently been to see 2, 3, 4 other providers solely, honestly, because they recognized that this was something that they hadn't been afforded the opportunity to have. And even if there was a placebo effect to it to some degree, didn't matter to me because I was helping them in some capacity. Fast forward to the fact that because of that interest in alternative modalities and a strong interest in pharmacology, I started getting interested in the endocannabinoid system that everybody has. And if everyone out there hasn't had the benefit of listening to your podcast, you do a wonderful job of bringing in people from all different walks of life. And it's really a system that has not been maximally taken advantage of to help with pain, to help with prevention of scarring in certain diseases, prevention of inflammation. For me to learn about that and educate myself about, use some of that knowledge in Connecticut, we call it certifying, to certify patients to then have the availability for medical cannabis to help with some of their chronic conditions, whether it be functional pain or pancreatic cancer pain, something I know you know all too much about, unfortunately. But these are things that we can really help our patients with by looking at other modalities that could be helpful.
You know, I'm reading your bio, and if anybody hasn't had a chance to read David's bio, it is on the MCRAA.org website, and it's very impressive. And to see the last two sentences were hypnotherapy and cannabis, you know, on top of everything else there, that really was impressive. You know, I work with so many families, patients, and doctors, and a lot of families and patients, as you're talking about, they're afraid to ask the question. I always share with them, it's not illegal, even if you live in an illegal state, to ask the question, and don't be afraid. This is your doctor, this is your health. And if your doctor is not informed about the endocannabinoid system, ask him or her if they can refer you to somebody. Nowadays, someone in your circle, if it's not you, David, it's someone else in your circle, knows about the endocannabinoid system. And I'm certain you get a lot of referrals from other doctors in your at the hospital, and did that refer them back to you?
Yeah, absolutely. And it's interesting because I still find that there's a number of physicians that are very reluctant to tackle that subject. I think because of concerns about regulation, concerns about stigma, concerns about what it might do from a reputation perspective. But I gotta be honest with you, I had the same reaction from people when I told them that I was going to be learning hypnotherapy. I could remember some of my partners who, and there's 16 of us in a group, telling me that this was not necessarily the type of thing that we necessarily wanted to espouse as a group, because people might look at us differently or think that there's some sort of quackery, so to speak, or what have you. And I said, gosh, I completely disagree with that approach. I think if anything, this might embrace a different patient population that historically hasn't been coming to see us. And it's nice to see that that's borne fruit, and that it's been nice to be available for patients who really run out of options from other traditional modalities.
You know, you say a lot of doctors about education, and I've run into that, you know, since 11 years that I've been in this industry, and the same thing. You know, when we arrived in this industry, we were kind of thrown into this with a family member who was diagnosed with stage 4 lung cancer metastasized to his brain. And when you have something as severe as that being diagnosed, you'll try anything, and you're open to anything. And so, I mean, even with my wife, when she had pancreatic cancer, we did hypnotherapy, we did every other modality besides chemoradiation, and pancreatics is a different breed. And so you know, for the doctors that are out there that want to learn, I think this is why we're putting on this event at the MCRAA event coming up here in March. Your passion to come into I guess putting your name and reputation into medical cannabis. Did you also run into that as other people looked at you? Because I know when we arrived into this, there was such a stigma for the longest time. You know, cannabis wasn't our lifestyle, and so people got upset that I didn't put Malunk in every press release that we did. It was just John, because family members weren't into cannabis. Other colleagues that I've had for the past 20 something years weren't into cannabis. And how was I going to break that? And the stigma, I mean, we were brought up,
sure,
cannabis med. My father passed away before he was able to see us launch this. And I'm thinking, how do I share this with my mom? How do I share this with my mom, what I'm doing? And I remember when I did, because cannabis, again, wasn't our lifestyle. When I did, she said, your father would be really proud. And she has seen what we've done with this and how many people we've helped, and education. It doesn't, and I'm the first to say it's not the golden pill, the golden ticket. Um, you're ill, take this and you'll be healed. I don't
Right.
use the word cure. So with your association, I guess, with the MCRAA and being one of the board members, can you share with our listeners why this upcoming event is so important?
Sure. Yeah, I think this event is important because it's the first event that we're launching to help educate really both physicians and patients, just to provide an opportunity for people to get sound information that's research driven. And there's many other vehicles for that. Of course, your United Patients Group is wonderful, and there's the Association of Cannabis Specialists. Jordan Tischler, you might know, is involved, and he's someone else that's involved with this. We'll be speaking at the conference as well. But it's another opportunity for us to educate patients and physicians and other people that might have an interest in this sort of realm of medicine. And I really want to speak to that concept that it is medicine, that we can then launch efforts to get more research done in a better way. I mean, currently the way that research is performed on cannabis, the cannabis that's available for federally funded research is available from one institution, in Mississippi. And there's really concerns that the quality of the product that's delivered from that institution may not be the best to look at in terms of deriving clinical trials and what have you. And we want to see more research driven. Medicine is based on randomized double-blind placebo-controlled trials. And that's what we need to see. There are some with cannabis, especially in my field. I treat a lot of patients with inflammatory bowel disease. I treat a lot of patients who've had wasting syndromes, either from malignancies or from HIV or what have you. But we need more research to then go and change the legislators' minds that this is something that really needs to be descheduled and more available for patients, to help them and avail patients and the general public with another means by which to help their chronic diseases, whether it's autoimmune disease such as Crohn's disease, fibromyalgia, ulcerative colitis, chronic pain syndromes that people feel, PTSD. Of course, many people are familiar with a lot of the pediatric literature with epilepsy. And it just seems as though we're sort of handcuffing ourselves and not giving it the full respect that it's due to see whether or not there's availability. I mean, if you want to take traditionally prescribed medications like morphine, oxycodone, OxyContin, they're derived from a plant as well. And so why not look at another modality that could be helpful with maybe some of the less bad side effects that opioids can have? I mean, we've seen raging opioid epidemic in this country. And unfortunately, due to the restrictions that have been placed on prescribing, what we're seeing is that a lot of people, a lot of physicians are, especially pain physicians, are very reluctant to prescribe needed amounts of opioids. And then you have a lot of governmental agencies placing pressure on these same physicians to give the appropriate dosages to patients. And then these patients are left in limbo. And so if we can come up with another modality by which to help these patients and also help maybe remodel some of the disease that they're suffering from, it's not just controlling pain, but it's actually changing the natural history of some of the disease states. There's data now, in vitro at least, because we haven't been able to do any randomized trials, that cannabis, the endocannabinoid system, if it's activated properly, can help with cirrhosis of the liver, can help prevent chronic pancreatitis, which is a risk factor for pancreatic cancer. I mean, these are disease states that are so difficult to control. Really, the only treatment for them is pain management or liver transplant in that capacity. So if we could find something that could really change the natural history, we could pretend and really prevent a lot of disease later on down the line for a lot of patients.
You nailed it on the head, prevention. And, unfortunately, medical cannabis was legal in the medical book since 1930. It was, I guess, legal until 1937 and then banned. And you share, I speak with so many, as you mentioned about on my own podcast, and who we've met over the years, and so many patients we work with. The thing that I always say is when people come at me, I say, I don't want to say it's like duct tape with 1,000,001 uses, but when you really get down to it, you can really find the benefits of this plant. And more are being introduced each and every day, especially with the different cannabinoids that are out there, THC being one, CBD, CBN, CBG, and the list goes on and on. More again are being introduced each and every day, and they all have their part in bringing the body back to homeostasis. And so, go on.
Yeah, I was
Sorry.
going to say, no, I was just going to say, and the one thing you just mentioned, the different cannabinoids, we're still learning so much. I mean, you're naming, everyone is, well, most people are familiar, of course, with THC. But now most people are familiar with CBD because there's freestanding CBD centers, and
Yeah.
that's not something that's necessarily scheduled in a way that it's illegal. Anyone can go into a gas station and buy a CBD product at this point. But there's so many other phytocannabinoids that we don't know a lot about, but seem to be therapeutic. You just mentioned CBN, CBDA, THCA, like all of these other phytocannabinoids that could be helpful. I think if it's rolled out in the right way from a research perspective and also from a regulatory perspective, I think it could be a home run for patients. And when I say regulatory, what I mean by that is in Connecticut, for example, it's very carefully distributed. A physician, this is why I think physicians may need to be a little bit more informed. All we are capable of doing is certifying patients, meaning identifying that we have a bona fide relationship with the patient. There's a condition that qualifies. I think there's 38 conditions right now in the state of Connecticut that qualify, including pain. And we're just certifying on the Department of Health website for Connecticut that this patient has this condition. We have a relationship. We're taking responsibility for the fact that we're recommending that the patient then go to a dispensary and subsequently have a conversation with a licensed pharmacist. In Connecticut, it's only licensed pharmacists that can actually dispense cannabis product. And these are people that would typically work at Walgreens or CVS or what have you. All the dispensaries, I think there's 18 now in Connecticut, they're all owned privately, but they're actually staffed by licensed pharmacists who, if they take the time to educate themselves about the pharmacology, can have significant impact on the way that patients are utilizing this. And if you do it with a research-driven focus and a carefully rolled out regulatory process, I think it's safe and it's well-founded in the way that it can be effective for people.
And I'm not here to correct, just for our listeners as well. I know you said 18 owned pharmacy. Are there dispensaries that they're owned, or they're pharmacies?
No, they're dispensaries. Dispensaries.
Yeah. Little guy.
Sorry about that.
I'm a big fan of dogs and children.
I've got 3 children and 1 dog.
I love it. So bring him to the table. So he's just happy you're home. Question for you. So for our listeners, I don't want them to think it's only for people on the East Coast. This is not only a US, but a global event that's happening on March 13th. And I know you mentioned we have patients, scientists, medical professionals, but I believe some politicians also speaking, correct?
That's correct. We're going to have some people, hopefully from the Biden administration, because obviously there's going to be a difference from the standpoint of the way that the cannabis policy may be viewed now. If everyone may not be or would be familiar with the Cole memo that was rescinded during the last administration, which was basically detailing that while things might be legal at a state level, either medicinally or recreationally, everything is still federally scheduled. So the Cole memo basically that was enacted during the Obama administration detailed that there would not be resources that were expended to prosecute or criminalize people that were abiding by state law. But then the last administration that is no longer in office rescinded that memo. And that added a little bit of a layer of concern for a lot of providers. So we're interested to hear from some government officials in the upcoming conference, how that might impact where we're going to see differences in the way that the policy is viewed.
Well, thank you, David, so much for being on, and for everybody. Cannabis policy across the globe is undergoing seismic change. It is no longer a question if a country or state will create a medical cannabis program, it's when. In the United States alone, there are over 36 states with comprehensive medical cannabis programs, yet healthcare providers still have much to learn. So join us virtually on March 13th as we demystify medical cannabis, from reviewing the endocannabinoid system, quality and potency concerns, policy considerations, and the current state of medical cannabis research. You will gain a solid understanding of the issues that matter to patients, healthcare workers, as well as research, as we work towards advancing research and policy in the modern age. And again, this is for medical cannabis, advancing research and policy in the modern age on March 13th, 2021 from 11 a.m. to 3 p.m. Eastern Standard Time, and you can click the link below to get your tickets. And Dr. David Haas, always a pleasure. Thank you for everything that you're doing, and really looking forward for upcoming event.
Thank you so much, John. Thank you for taking the time and availing your services and your talents to really recognizing MCRAA and highlighting the conference. Really appreciate everything you're doing for advocacy as well.
I appreciate it. And one thing that I always share, I always say it's like a pebble in the pond, throwing the pebble in the pond, the ripple effects. And someone listening to our podcast interview right now goes and shares with their doctor. So everyone, have this conversation with your doctor, have this conversation with your family, and we'll see you on March 13th. Have a blessed day. Bye-bye.
Thanks so much.